I also come from a Marwadi family. For me, business is really in my blood.
What is the current status of the market? What do you see in the market?
Doing the course myself gave me so much more structure. Innovation that we wouldn't have imagined is happening at one end. So there are these three aspects to the market that I see, and I'm very excited to see how it all unfolds in the next decade. Public-private partnership is the only way to make healthcare innovations accessible.
Hi, I have pleasure in welcoming Runam Mehta, a person who has been very familiar with the healthcare sector, initially as a clinician, qualified physiotherapist, a practicing doctor, and later as a business person working in the healthcare space. She had worked with home healthcare companies. She is the CEO of a medical devices company in India. So she has perspective from the commercial side and from the practicing side. Welcome, Runam, for this conversation.
Thank you, Ganesh.
After doing all that and having a successful practice, what made you this shift to big bad world of business?
Actually, Ganesh, see, I am a qualified physiotherapist, but I also come from a Marwadi family. So for me, business is really in my blood.
In your DNA?
It's in my DNA. I think the transition was very organic. When I moved, I had a clinical practice in Bombay. When I moved to Bangalore, I was trying to figure out where I fit into the ecosystem, and I happened upon Portia. And I walked into Portia at a whim, and then I realized that this was an opportunity for me to do much more good and reach much more, many more patients, than I could possibly ever reach through a clinical practice by working with an organization like Portia. How the entire transition played out is, one, I have been presented with a number of opportunities, and I have more often than not said yes. Number two, and very critical, Ganesh, has been the mentorship that I received.
That's fantastic to hear, because we are talking at Indian School of Business. We have a flagship program called Advanced Management Program in Healthcare. Right, it's been running for more than a decade now, where we had doctors coming in to learn management principles, and you actually have done that. You also did that executive MBA program at IIM Bangalore. So tell us, how much does a management program, formal management education from a top institutes, does it help in a clinician or healthcare professional in their career?
Absolutely. I think there is no two ways about it. I mean, though business has been in my DNA, and therefore I was fortunate to have some basic principles, that I've learned at the dining table. But doing the course myself gave me so much more structure to things that were just a concept earlier. Now, for clinicians who do not have the background that I have already, I think this is absolutely critical if they wish to make a transition into corporate, into management, into running a business.
Or professional growth or career.
Or even professional growth in their own career. I think it's absolutely important to get some structure and to also hear from people who've done it themselves, from industry folks like yourself.
Coming to the actual medtech sector or healthcare devices sector, what is the current status of the market? What do you see in the market?
I think today where we stand, there's a lot of innovation that is happening. Every other founder that I speak to has a device that, at least to my mind, it's unimaginable how they've built the technology. Just today I was talking to somebody, apparently they are creating a sniffing device that has 10x the capability of sniffer dogs. Innovation that we wouldn't have imagined is happening at one end. At the other end, we have regulatory bodies, but is the regulatory able to keep up with the pace of innovation? And what can they do in order to keep up with this pace? Because regulatory needs to ensure that there's no malpractice, but they also need to leave room for innovations to grow. And that's a fine balance. So that's number two. And at the third end, we have the ability of the market. When I say the market, I'm saying the incumbents in the market, the hospitals, the insurance players, the doctors. Do they have the ability to very objectively view these innovations and accept the ones that aid the consumer, not view them as a threat, but as an opportunity? So there are these three aspects to the market that I see, and I'm very excited to see how it all unfolds in the next decade.
One of the things which we have always been grappling with, people in the healthcare field, has been this fact that quality healthcare is inaccessible for most of the masses. Yeah. India has got the best of the doctors, best educational institutions and best hospitals, latest infrastructure, but masses in the rural areas can't have access to it or just cannot afford it. Do you see this entire medtech revolution where we use a simple Android or a smartphone, which already is there at very low cost, internet access which is there at very low cost, as a panacea, a solution to this access for diagnostics?
Absolutely. I think, Ganesh, because internet penetration, availability of, access to at least internet, Android devices has surpassed all projections, I believe. There are innovations also in place. I think what the industry innovators need to do is at some stage realize that for the masses, the government is going to be the largest spender. As innovators, we cannot afford to ignore the government.
So you have to work with
You have to work with the government. You have to work with the regulatory bodies, one, to get your innovation accepted, but also as a buyer.
As a distribution.
As a distribution channel, I think the government is a channel that healthcare innovators cannot afford to ignore, and it is only through partnership with either CSR money, which also sometimes flows via the government, and partnership with the government. Public-private partnership is the only way to make healthcare innovations accessible.
Take HealthCube company that you have been leading as a CEO. What are the go-to-market strategies that you have found to be useful? What you have tried has worked or not worked? That will be useful because scaling of these business models is something which people always question.
Absolutely.
Innovativeness is there and the technology is there, but can it really scale? So what's your piece of advice for people in the space for go-to-market strategy?
I think the first thing is to understand that whatever product or whatever innovation you've built, whose problem is it really solving? And if it is designed to solve the problem of access, which is what HealthCube has been designed to do, HealthCube solves for access. You can't solve the problem of access in Bangalore. There is no problem of access that exists.
Because a doctor diagnosis, everything is available.
Exactly. So you have to solve this problem in an Uttarakhand or in a Nagaland, or even in Africa, parts of Africa, Latin America, etc. And your strategy, your GTM has to be about and around the institutes that spend on these sectors. So CSR, though we haven't scaled very large in CSR, but our close competitors have made CSR very, very successful. The second, like I said earlier, is a government. We work very closely with a few state governments and have been supplying to them for years. And the proof is in the use of the pudding, right? The fact is our devices are being used in PHCs, and we know this because our consumables have recurring demand. So that's what we've made immensely successful. And the third thing that's been successful for us has been to find other people, private partners, who also intend to spend in these areas.
Give me an example of a private partner. Is it CSR or it need not be CSR?
No, it need not be. It can be an institution. So we have, for instance, an organization, also a startup, called Cloudspital, that is setting up health ATMs.
Health ATM. So yes. They would buy this from you and it will be part of their entire health ATM service.
Exactly. So
and we also get a customer.
So we get a customer and we are core to their technology. They cannot grow without kind of taking us along with them. So that's one example, and we found multiple other teleconsultation players, outreach clinics, etc., that we're able to sell to.
Thank you very much for speaking with us.